All right. Well, welcome everyone. My name is Nicole Christensen, and you are on an exciting Medicare panel. So again, my name is Nicole Christensen. I am the president of Care Answered. We provide patient advocacy and care coordination. We navigate people through the healthcare system. I'm also the author of the book From Crisis to Calm. So I have with me some very distinguished guests that are going to bring about and make us understand all of the Medicare, how it works, when we call them. And everybody that is part of the panel is a Medicare broker, or I call a Medicare expert, who helps to navigate people through Medicare. So it's different from the folks you might see on TV. It's different from somebody that has just one insurance that they represent. All three of these wonderful individuals help people at no cost to find the appropriate Medicare plan for them, or if Medicare is appropriate for them. So I have worked with all three of them for not only my clients, but for family and friends. And they're just a wealth of knowledge. And I'm very excited to have them share their expertise with you today. So without further ado, let me introduce them in alphabetical order. So we have Al Anastasi. You can raise your hand, Al, wave around. Al has been helping seniors with Medicare since 2017. Since retiring from his day job, which was in the human resource and insurance industries, Al has narrowed his focus and now works exclusively in the Medicare space. He educates and guides seniors and other Medicare eligible people, helping them make the best choices for their individual circumstances. As senior himself, Al brings both personal and professional experience to the table and is able to provide the unbiased guidance that his clients want. Al is licensed in 8 states currently and works out of his home office in Seaford, New York. Next is Jane O'Malley. Jane has been an insurance agent since 1993, but specializing in the Medicare space since 2015. She particularly likes working with the senior population. Her goal is to find the most suitable, comprehensive, and affordable plan for each beneficiary. She is patient and strives to have each beneficiary happy with the plan they choose. And last but certainly not least is Stuart Small. He is an independent insurance broker specializing in health insurance with a focus on employee group benefits and Medicare planning. Stuart is a long member of many insurance-related associations, including the National Association of Health Underwriters, the Health and Business Alliance, and the Senior Umbrella Network. Stuart treats each person as an individual, working with them to take the confusion out of their Medicare decision-making now and in the future. So welcome, Al, Jane, and Stuart. We're gonna hit right off with all of the basic questions of Medicare. And I'm gonna start with Al. What is Medicare and what does it cover? We hear alphabets, we hear A, B, C, D. Can you give us kind of a quick description of what it all means?
Absolutely, Nicole, and thank you for having me on the panel. I'm looking forward to this. Medicare is essentially a health insurance program designed specifically for the elderly. It also does cover people that are under 65 if they become eligible by virtue of disability, but most of the population that is on Medicare are 65 and over. Medicare was signed into law back in 1965 by then President Lyndon B. Johnson. And today there's over 60 million people on Medicare. It's a really, really big deal. And that's growing because people are turning 65 in the US at the rate of 10,000 per day, and that will continue probably for at least the next decade. So think of 10,000 a day times 365 times 10. How many people are going to be on Medicare in 2033? So what when Medicare was conceived and came into law, it was broken up into two categories, um, hospital and medical, Part A and Part B. So Part A being Medicare, covering hospital again, B covering the day-to-day outpatient medical. And it stayed that way today. So you'll hear the term original Medicare thrown around a lot, and that's what it is. So when you get your red, white, and blue Medicare card and you join the Medicare community, if it has A and B on it, you have original Medicare. All right, so what's happened is that Medicare, when it was designed, was not designed to cover everything and everything 100%. So the industry has grown to, and I'll call it supplemental options have come into play. So I'll give you an example. If you go to a doctor and all you have is original Medicare, you're going to be covered for approximately 80% of the doctor bill or whatever was approved by Medicare after you pay a small annual deductible. But that 20% can add up, and depending on whether it's a doctor visit or an MRI or something that happens in the hospital or dialysis or whatever it might be, there's certainly a lot of exposure with just that 20%, and there are other aspects of Medicare which are not covered that well. So again, you have these supplemental coverage options. So just kind of summarize, you have Part A and B, but now you have Part C, which is Medicare Advantage, and I'm sure we're going to talk a little bit more about Medicare Advantage. But in essence, what it is a different way of getting your Medicare. So when you go to the doctor, you don't give them a Medicare card, you give them the card from your insurance carrier, and the doctor, rather than billing Medicare, bills the insurance company, and everything is kind of rolled into one plan, similar to what you were used to when you had employer insurance. The Medicare Advantage plans are HMOs and PPOs, and again, we'll talk a little bit more about what they cover and who they're appropriate for and things like that. But the other way that you can get Medicare is through something called Medigap or Medicare supplements. And something I kind of left out back there is prescription drug coverage, because that's the big thing that Medicare does not cover. And oddly, Medicare mandates that you have prescription drug coverage, but it's not part of original Medicare or the package that you get from the government. So when Nicole mentioned A, B, C, and D, yeah, you have your A and B, and then you have C if you opt into Medicare Advantage, and D for prescription drugs. And there's also something called Medigap again, or Medicare supplement, which is another way of ensuring the 20% gap that Medicare doesn't cover. So there are a host of different options with Medicare. If you look at full coverage for Medicare, in the Medigap world, it would be Part A, B, a Medigap policy, and a standalone drug plan. In the Medicare Advantage world, it would simply be a Medicare Advantage plan, which incorporates all of that, including the prescription drug plan.
Okay. So thank you, Al. So we can understand how confusing it is, right?
Yes.
So, but that was very well put, because there's a lot of different choices. I want to just add here that there's often a lot of confusion when people come to me, and I'm not asking the panelists to speak much on it, but unfortunately, it's unfortunately named, right? That there's Medicare and Medicaid. They sound very similar and they are not the same. So I want to say it again and again. This is Medicare, which really they can work together, but really very, very separate and unique programs. So we're talking about Medicare, as Al had spoken about, mostly for people 65 and over, although there are exceptions, but that's what we're talking about today.
Mhm.
So now,
May
Jane,
I just, I was
sure,
going to just jump in with a
please.
little detail I like to always point out is some people assume I turned 65 and I automatically get Medicare. And in fact, you actually have to do something usually. You have to actually enroll in Medicare when
Mhm.
3 months before you turn 65, unless you're collecting Social Security income, then it does happen automatically. So that's important because some people just wait, 65 comes and goes, and they never took care of it, they forgot. And the other thing I just wanted to add a little bit is that the Part A that Al mentioned, hospital coverage, normally you're entitled to it because you pay taxes and during your working life or your spouse did. The Part B is actually a cost to obtain Part B. So, and everybody has to get A and B eventually. And sometimes people think if they go to Medicare Advantage, they don't need, let's say, the A and B. That's sort of like the entry. Everybody starts by getting the A and B, then they can consider if they prefer to have an insurance company, a private company, provide their claims coverage versus the federal government, which is original Medicare. And that,
Okay,
I
thank you
just
for
wanted to
the,
kind of fill in those details.
Yep.
absolutely, and we're going to get more into that. So Jane, can you tell us more about open enrollment? When it is, how does it affect me, my clients, my loved ones?
Sure. And Alan Stewart had really laid a very wonderful groundwork with lots of information. And, I think Medicare initially is like, oh, this is so simple. Well, it really isn't so simple because there are a lot of parts and pieces and a lot of moving things. And so it is necessary to have somebody to help you navigate this whole thing. And that's what we all do. As far as open enrollment, here we are. We are in the throes of open enrollment right this moment. It starts on October 15 and it ends on December 7. During that time, you can make as many choices as you want. As an agent, we hopefully want you only to make one because our life is so busy right now. But if you find that you've made a choice and you're not happy with it, you have the opportunity to make another choice. Whatever is on at December 7 is what sticks, and it is going to be effective for January 1. So right now, we are making all decisions with our clients to have an effective date of January 1. October 1st of each open enrollment is when the agents can actually speak with a client. So if we know that there's something that's going to be happening, and this year there are things that are happening with some carriers dropping some of their plans and so on and so forth, then we can sort of get heads up with some of these clients and help get them prepared ahead. But we cannot write until October 15. In other words, we cannot send in an application until October 15. For those that do have changes and that their plan is being dropped by no fault of the client, it's from the carrier, they actually have until the end of this year, until December 31st, to finalize their choices.
Perfect, thank you.
Mhm.
So Stuart, can you tell us about what you need to know for if somebody's coming and they're trying to make their decision and make the best decision for themselves, and they come to any of you, what do they need to know to be able so that you can help them select the appropriate coverage?
Well, it's interesting because everybody is an individual when it comes to Medicare. And one of the things that people find is they're so used to a couple being a couple, let's say on employer group benefits. One of the first things I have to tell them is you no longer have to have exactly the same plan as your spouse. So I'll talk to you together, but understand that one of you might make one decision and the other another. So the first thing I try to find out is what coverage they currently have. And can they even perhaps stay with that coverage? So that's the first thing I'm determining. So sometimes you don't have to do maybe what your friend or neighbor did, because if you work for a larger company, and when I say larger, just really 20 or more employees, and you like your benefits, you might be able to make different decisions than other people. You might be able to stay on that plan. But if you don't like that plan, it's not favorable for you, or you don't have any other option, then we proceed to look at questions regarding their health, their prescription needs, and also perhaps where they spend their time. Are they a New Yorker? If so, do they spend most or all their time in New York, or are they spending a lot of time traveling? Do their doctors participate with various plans? So that's one of the things regarding Medicare Advantage, where we look at there may be Medicare Advantage, the network of doctors is a subset of the doctors that are in original Medicare, meaning your doctor might say, I take original Medicare, but I do not participate in any Medicare Advantage plans, or they may say I participate in some. So once we have, the most important thing is to really make sure there won't be a disruption in the providers they see and get the services they require. So that's really basic information that we gather, and that starts us in the direction of, and honestly, I think we all explain all of the options to our clients, even if they're pretty sure they want to go in a certain direction. We try to I ask for permission. Can I tell you about the other options, just so you'll know about them in the future, in case things change. So that's my
Absolutely.
beginning approach.
Thank you. Thank you. And I think that's really important, because when people come to Care Answered, they have a lot of things going on, and what's happening historically and what they need can be the same or different. And I feel like you all really help them make the best decision based on that information, including everything you just said.
Nicole,
It's
can
really
I?
important. It's
I'm
really
sorry.
important, I think, for them to understand both sides. It's like, do you want vanilla or do you want chocolate? And they need to understand both things. They need to understand what original Medicare is, what the pricing might be, what their responsibilities are, and they need to know what Medicare Advantage is and what their responsibilities are there, so that they need to make their own decision, and they need to have all the things in order to make a decision. So it is important that they understand both sides.
Yeah, I agree with all of that, and I think I say to a lot of people, look, making a Medicare decision isn't a lifetime decision. You make a
Mhm.
decision and you can change that at least once a year. But the decision really needs to be made on medical need, financial resources, and also something called mindset. What kind of coverage do you feel comfortable with? So those are the three things that I try to go over with clients. And the travel thing is very important. Stuart alluded to that. Also, something that comes into play: are they a veteran? All right, and if they're, what level of veterans benefits are they eligible for? That all needs to be factored in.
Yeah, absolutely. Al, since you're up on my screen anyway, let me ask you about the commercials. We hear about Advantage plans all the time, and we've mentioned them briefly. All three of you have mentioned them briefly. And you gave a nice description, but can you explain to us a little bit more in detail what are these commercials, right? Because the commercials, I'm always like, what? And then what is an Advantage plan? You spoke a little bit about original and an Advantage plan and a supplemental plan, but if you could just explain the Advantage plans a little bit more, because I find that that people often ask me about it, and I feel like the commercials are sometimes confusing.
And
Confusing,
misleading.
misleading. Thank you, Jane.
Yeah.
That's exactly what I was going to say.
They're not
Um,
public service announcements.
No,
That's right. And, you know, Joe
they're
named
the
it
bane
Jimmy
of
Walker,
our
whoever.
existence.
Yeah, exactly. And they've caused us more than a few headaches that
Yeah.
going forward. So it's a shame that they do it the way they do it. But essentially, what the commercials are, these are broker firms that are fronted by call centers that are trying to get, and the commercial promise the world. It's extraordinary the things that they promise. And probably all the things that they promise are available in some plan, a piece here, another plan, a piece there. A lot of people that are on Medicaid get a lot of these benefits, but they make it sound like, you're going to get everything that is out there just because you live in zip code 11783. Well, that doesn't necessarily, that's not necessarily true. So I've had several clients call me and say they've called up the hotline and spoken to somebody, and they found out that no, you're not eligible for, but we can do this and that, and they transfer them to an agent, and eventually they hang up. I haven't lost anybody to one of those call centers yet, but because there's really not a relationship being built there. It's simply an enrollment facility. They want the clients to pick up the phone, so they tell them what they want to hear. They pick up the phone, and then they try to convert them to be a customer. All right. And yes, they're talking about Advantage plans. Advantage plans, as I said earlier, Medicare Advantage is a way of incorporating all of Medicare into one HMO or PPO. It's a very attractive way for people to get their Medicare, because from a premium standpoint, it's usually very inexpensive. Sometimes there's no cost at all to having a Medicare Advantage plan. So you can have your medical, you can have your hospital, you can have your prescription drug coverage. You may even have some things that Medicare doesn't cover, because Medicare doesn't cover dental, vision, and hearing. And some of that may be factored in. Some lifestyle benefits like fitness and nutrition and things like that are built into these plans. So they're very attractive from a benefit standpoint and from a cost standpoint. What you need, what I think people need to be educated about is that if you fall into a category where you have significant health issues and you're making a lot of doctor visits, or you're getting a lot of therapy, or you're taking cancer drugs, or you're in and out of the hospital, these plans can become very, very expensive, because the way they work is, again, very low or no premium, but you pay as you go. So if you don't go, then you don't pay. And that's very good for a lot of people, all right? But people sometimes will go into an Advantage plan kind of frivolously, just to save money. And it may not be the right decision for them. When you looked at the three things that I look at, which was health, finances, and mindset. Right, that they may have the mindset for Medicare Advantage, but it may not really fit from a medical need standpoint. But they're a great program. You certainly have to, if you're in an HMO or a PPO, you're in a managed care plan, and you need to play by the insurance carrier's rules. So you need to stay in network. You need to deal with their pre-certifications and the rules that they have. And you need to realize that for the most part, the doctor and the insurance company are going to make a lot of the health decisions for you. All right, which is not the case with the other way of getting Medicare. And if you can live within that box, if you will, then you can do very, very well on Medicare Advantage, especially while you're a little younger and healthier.
So
When I see
what I'm hearing, Al, is that it's definitely an option and it may be good for you, but you can speak with one of these great folks and find out if it's really best for your needs at the
exactly,
time.
exactly.
And Jane, I'd like you to speak, if you would, a little bit about, because we talked about open enrollment and you helped us with that. And we were talking about just now the Advantage plans. Are there other ways in which maybe we selected an Advantage plan or a different kind of plan and life circumstances have changed and we can change outside of the open enrollment period?
Yeah, absolutely. There's a couple things that happen. First of all, January 1 to March 31, we have what is called open enrollment. Not the annual open enrollment, is which we're in now, but it's just called open enrollment. And from January 1 to March 31, you do have one option to make a switch, and that is within the Medicare Advantage space. So if you've chosen a Medicare Advantage plan and you say, oh, this really isn't going to work for me anymore. I don't really like it. I don't like what I thought it was, or whatever the reason, you have an option to get out. This year in particular, we've had several FEMA special enrollments, and it's been good for the agent and it's been good for the consumer because it allows them in July, when there's no special enrollment period or whatever month it might be, if there is a FEMA special enrollment period, all right, we'll use it. We can move you. We'll get you out. You don't have to wait for annual open enrollment. You don't have to wait for another time. So we've had several of those this year. I mean, we've had COVID, we've had monkeypox, we've had gun violence. It's been endless. Most of them are coming to an end now, but those are other times. The other thing that we use and many people don't know about and don't really understand, and sometimes they don't need to understand, is what we call EPIC. EPIC is the elderly pharmaceutical health plan, and what it is, it's set up by New York State, so it doesn't happen. I mean, there are other states in the country that have similar plans, but it's not called EPIC. In New York, it's called EPIC. And at that time, it's set up so that if somebody were to, it's for prescription. I think I said that. I don't remember whether I did or not, but it's for prescription. So if somebody actually has spent retail and what they have spent out of pocket, when that adds up to, I think it's now $4,600, then you fall into what we call the gap. And many people have heard that term and they're not really sure what it is. But when you fall into the gap and you do have EPIC, there'll be another deductible to meet based on their income. And then the highest cost drug would be capped at $20. So it's a great program for especially asthmatics, diabetics that are on very high priced drugs because they fall into the gap early. So that sometimes is a very, very helpful thing. However, I always kind of say to my people, this is kind of like a lotto ticket in your back pocket. If in fact, in July, August, whatever, and you are a member of EPIC and you need to get out of your plan, we can use that as a special enrollment period to move. It doesn't necessarily have to be because of your drugs. So we usually have, times during the year that we can move you out, and that's very helpful.
Excellent. Yes, I
Yeah.
think that's really
Yeah.
important for people to know. Stuart,
And
do
I want
do
to
you have
throw-
something to
Yeah.
add?
No, I think it's great that Jane brought out Epic, and I use the same, I say like it's a get out of jail free card. So I think when we enroll people into a Medicare Advantage plan, they're happy when they enroll in it because we did our due diligence. But I always point out to people that people are happy with it until they're not.
Mhm.
Ideally, you can anticipate that life has changed and perhaps you'd like to switch for next January. But when it happens unexpectedly, I tell everybody, even if you don't take drugs, sign up for Epic. It's free. Keep it aside if you qualify, because just in case you ever have to switch out of the program you're in now, we can do it off cycle. But what comes up several times a year for me is I'll get a phone call, maybe even from you, Nicole, about somebody who's in a skilled nursing facility. They've been getting rehab. They've been there for a few weeks, and they're being told by the facility that their Medicare Advantage plan said, it's time for you to go home. But in fact, your doctors and the facility and your family don't agree. Now, if you're on original Medicare, you wouldn't be getting told it's time to go home by someone other than the medical professionals. But a Medicare Advantage plan may say it's enough, and you may appeal and it may get denied. People realize they're going to spend a lot of money out of their pocket to keep them there. Guess what? Being in a skilled nursing facility or being released from one actually is a special enrollment period. So I have some nursing homes that call me because they have a patient who they really think should be staying there for another 3 weeks, but now their insurance company is not willing to pay for it. We sign them up for a prescription plan, a Medicare supplement, the first of the month. Now they're covered again with original Medicare. And it's been a real saver for some people who are in that situation.
Mhm.
Absolutely. I definitely have experience working with all of you in that situation. There's something else that that came up in regard to where you live. So can you talk a little bit, Stuart, about that? The differences in New York versus in another state?
Mhm. Right. Yeah, us New Yorkers, I don't know if everybody here is from New York, but we tend to think whatever we do here, it's like, oh, same everywhere. And then we find out, no, New York is kind of different. So in the vast majority of states, I've been told 46 of the states, they don't have what's called guaranteed issue. In New York, if you want to sign up for a Medicare supplement to fill in the gaps in your original Medicare, doesn't matter about your health or anything else, you can always sign up. You can never be denied, and you can never be charged more than the next person. Well, in those other states, not true. So we get people who, let's say they're moving to North Carolina or Florida, they're living there. They get sick. They realize Medicare Advantage is not appropriate for them. And now they cannot get a Medicare supplement because they have to answer about 14 medical questions to qualify. So that's come up. I always tell everybody, a lot of people, when you turn 65, you're thinking, I might relocate to a warmer climate. And I always mention to people, I ask them, first of all, are they planning to move? And I say, if you ever decided to move out of New York, particularly if you're on a Medicare Advantage plan, let's talk, because you could switch back to original Medicare with a supplement while you're in New York, and then it's portable and you take it with you. The only thing that happens is when you get to North Carolina, you give me a new address and they lower your monthly premium because it's based on your zip code. So I have that conversation with folks that always, before you move to another state, it's good to review with your broker how that may affect your plans. So New York is probably the most liberal state regarding the ability to make changes in your plans. So that's something to keep in mind. But also, we tend to have the highest monthly premiums for the same products. And part of that is because it doesn't matter your medical condition, you can't be denied the plan.
Great, thank you. We talked, Al, a little bit about Medicare before, and people thinking it's automatic. So if I'm 65, I'm still working, how does it affect me?
All right, so 65 obviously is the magic number for most people. And you need to kind of have a plan. I tell people to engage with me at least 6 months prior to turning 65, and we need to look at several things. One of them Stuart had mentioned is, are you working for a company with less than 20 employees? If you are, you really have to take Medicare care, and you could stay on your work coverage, but Medicare is going to be the primary payer. If you don't have it, you're going to have some pretty high medical bills. Another thing that you need to take into consideration is you need to really do an analysis of what Medicare offers for you and what your options are with your work coverage or your retiree coverage, or union-based retiree coverage. So when you turn 65, the analysis it needs to be done prior, obviously, and it needs to include again the three things: the cost, the finance, the mindset, and the health situation. Where do I want to be when I turn 65? So if you're working for a company that is paying 100% of the premium, you have a really good health plan, you can probably want to stay on that. You're going to want to stay on that plan, and you can. And you can pick up Part A because it's free, and you can defer Part B. And one of the biggest, most common questions I get is, if I don't take Part B when I turn 65, am I going to be fined when I take it eventually? And the answer is no, as long as you have creditable coverage, which your work coverage would be. So you can maintain your work coverage and defer Part B, so you don't have to pay that Part B premium, and keep that plan until you retire. Now, if you're going to turn 65 and you retire, then and you have the availability of a retiree program, that's not an automatic. You really should analyze the coverage level and the cost of that retiree coverage. I've taken a lot of people off of retiree coverage. I don't do it frivolously, because once they get out, they usually can't get back in. So it has to be a solid equation that works for them. But you want to look at it and make sure which way to go, because remember, when people retire, usually their income goes way down. So every drain on resources is important. So you need to look at all angles. And that's really kind of it. It's the
Yeah,
analysis
it's a
that you
big question, right?
Yeah,
It's one that I
yeah,
hear a lot. So
yeah.
that I think is really helpful. And I think the key here for everyone is to call a broker beforehand, afterwards, during, just so
Yeah.
that you know all of your options, because they change and things change and your circumstance changes, and you want to make sure you know all of your options so that you can make the best choice for yourself. And everybody here can help you do that. So
Right. And can I add one more thing to
sure,
that?
please.
Sure.
Even though you've made the option to go into Medicare from retirement, whenever that is, whether it's 65 or later, um, it doesn't happen quickly. Social Security does not move too quickly. They move at their own pace. And so, you can't expect that, you've got a birthday in November and you're going to call me on the 15th of October and you're going to get covered. It's not going to happen. So you really do need to plan way ahead. As soon as you know that you're going to retire, at least within 2 months of retirement, then you need to have, number one, a conversation with the HR people so that you know exactly where you stand and what your options are at retirement. And secondly, if you are going to go into Medicare, now's the time to get the letter, because the HR people do have to fill out a form that you are going to be covered until a certain date. And then start working with Social Security so that you can get your plan in place by the time that you need it.
Perfect.
Yeah.
Thank you. So another question is, speaking of changes, right? Each year or each day feels like there's changes. So, Stuart, can you talk to us a little bit about changes that you're aware of for this year?
Yeah, well, for next year, 2023,
Yes, sorry.
actually, there's a couple of things that we should be happy about, kind of excited. I feel that, well, you mentioned I'm a member of NAHU, National Association of Health Underwriters, and they did a lot of lobbying there's a lot of rules. You go, why do they have that rule? That's not good for people. And some of them, CMS, Center for Medicare Services, actually is improved a few things for next year. So I'll give you some good news stuff. So
Yeah, I like good news.
Yeah,
Bring
good
it.
news stuff. Yeah. So a couple of things is, one is that, when, I don't know if Jane mentioned the general enrollment period. There's something called general enrollment period. So this is a bad thing. If you didn't enroll when you were supposed to enroll, you waited, I left, I didn't sign up for my Medicare Part B when I was supposed to, and which is, shortly after you left the employment. And now they say, oh, you got to wait for the general enrollment period. So I get those kind of calls. Somebody was healthy, but now they need Part B. So now they want to sign up. Well, you missed your opportunity. So you have to wait till the first quarter, January, February, March, to sign up, and your Part B won't go into effect till July 1st. And that's the way it was. So I would get those calls sometimes. Somebody was in August of 2021, and they wish they could sign up for Part B. And I go, you missed, you can't do it. They won't let you. You're going to have to wait till January to sign up, and you won't go into effect till next July. So now it's like 11 months later till I can help them with the rest of it. Well, the government finally eased it up a little bit in that the general enrollment period is still the first quarter, but it goes into effect the first of the next month. So if you kind of blew it and you want to sign up, you have to wait at least till January, but your coverage will go into effect February 1, if you did it in February, March 1. So to go into effect right away, you don't have to wait till July. So to me, that's a bit of relief, maybe a 5 or 6 month relief in that regard. So that's a plus. Another thing that's gotten better for next year is vaccines. A lot of people question, why don't they cover other vaccines? They cover flu at no cost. Why don't they cover the very important shingles vaccine? Shingrix is the name that a lot of people hear about. And my clients always say, how come it's going to cost me, potentially, some people say it might cost me $400 to have my 2 Shingrix shots. And, it's very important to do it because the disease itself is really not good. So next year, so if you were planning to do your Shingrix vaccine in the middle of December, maybe you want to wait till January 1, because next year it'll be like a flu vaccine. It'll be $0 next year. So that's a good thing. That's a positive. So we're seeing they're also going to start negotiating on a select number of drugs over the next couple of years, with 10 drugs, then 15, where they can negotiate where they never allowed it. So certain drugs will now perhaps be lower cost, where Medicare in the past never could negotiate on drug costs. And ultimately, if we're all holding our breath that in 2025, and this is part of the Inflation Reduction Act, that in 2025, there's going to be a $2,000 cap on the most you could spend on prescription drugs in a calendar year. Right now, there is really no limit. We talk about you reach the donut hole or catastrophic level, you still might be paying, even catastrophic, 5% of the cost. And there are some drugs my clients are taking that are $10,000 a month retail cost. So even in the catastrophic stage, it's still $500 a month for that one drug. So hopefully the government won't mess this up. And I wish it was sooner, but something to look forward to ultimately for those who are taking, let's say, cancer drugs by pills, MS, those kinds of drugs, a small percentage of population, but very important. So those are a couple of the things that I wanted to mention is, to me, those are improvements for next year. There's also some arguments out there that hasn't been approved yet, we've been lobbying for, to allow COBRA to be considered like creditable coverage. You know, sometimes people left their employer plan, they've maxed it out, so they have no more expenses for the rest of the calendar year, and they turn 65, but they really can't stay on the COBRA. You know, it's not favorable for them to do so unless they have Medicare A and B. We're hoping that that'll ultimately be passed. Most people won't elect the COBRA, but in some cases, it could be, I want to stay on the COBRA so I can keep covering my child or my spouse. And that might be my reason for staying on. So those are some things I wanted to share. There may have been a question or two in the chat that popped up. Related to
so there's a question, and then we'll have some not so good news, I think, that Alan and Jane can talk about if there are any changes. But Jerry asked, are Part B premiums going down according to the Biden administration inflation reduction measures?
Well, the Part B premium went down a few dollars, which is better than it going up. And it's not really because of the Inflation Reduction Act. It was because they raised it too much last year by mistake, because they thought they were going to have a huge cost related to an Alzheimer's drug, and that didn't come to be. So we were lobbying for them to lower it immediately, like last April, and refund the difference, but they didn't. So that's why it's lowering about $6 the monthly premium, but that's better than it going up, and that's the reason, is because they've done recalculation. So that's the Part B part of that. And
they're also going to lower the deductible for Part B.
yeah, the deductible
Correct,
also went down a little. And and it's for that same reason. It's correlated with the Agilem, which was a prescription drug. I saw someone ask about fees, but if they're referring to our fees.
Wendy asked about fees. And as I mentioned in the beginning, I don't know which fees you're speaking of, but they don't charge fees. Wendy, you can speak up if you want to unmute yourself.
I'm not talking about your fees, just to clarify. I'm talking about how is this based? Is this based on our income?
Well, the Medicare Part B, everyone pays initially a standard premium. Last year was $170.10. Next year it's a little less, like $164 something. Then there's something called IRMA. IRMA stands for an income-related modification adjustment. That's based on your income from their last tax return they have. So like right now, they're using your 2020 modified adjusted gross income on your tax return. There's a line that says MAGI. They look at that, and there's 5 categories above the base amount. So if your income is over certain numbers, and we could share that chart with you if you don't have it, you know, one of us could get it out to you. But you could be paying, some people, instead of paying that $170 this year, some of my clients are paying over $500 for Part B because their income was quite high. And just to note, as Al said, so many people's income drops dramatically when they retire. So what do I do if they tell me my Part B is based on my income of $750,000 from 2 years ago, but now I retired and my income is dramatically lower? And I get this all the time, you know, retired physicians typically. So there's a method for appealing it and saying, hey, look at me, my income went down dramatically. I don't want to wait 2 years for you to notice. You fill out a form. It's called SS44. There's a form I share with my clients. You fill it up, you send it in, and they're very cooperative. They correct the Part B, and they actually refund any overpayment. But it is based on your income.
Right. Excellent question, Wendy. Thank you for
Yeah.
asking it. I know that, and Alan, Jane, you can jump in here. I know that there are new protocols for you guys too that have been changed, I think due also to CMS, regarding recording conversations, which is kind of new and could be surprising to people. So I like to make people aware of things. So Jane, how about you start us off regarding that?
Yeah, in the beginning, it was like, oh my God, why didn't they do this 3 months ahead so we had a chance to kind of figure out how to handle this and so on and so forth. And yes, I had to get an app on my phone, and yes, there is an app on the platform that I use. But so far, it hasn't been as cumbersome as I thought it would be. What I have, I mean, and also just the kind of it's all varying interpretations. Every carrier basically has a different interpretation of what has to be done, and CMS has an interpretation, but it's rather vague. So it still leaves a little bit to be desired as far as agents are concerned. So what I normally do is, put I tell the person that I'm going to call them back on another number. And I tell them what the number is, and then read the disclaimer and just go on from there. So we would have a normal conversation like we normally did. I mean, even today, somebody's telling me about the dog groomer and this and that. And I'm like, well, this is the way it is. So, it stayed on the recording and we went on. But yeah, so I mean, it can be cumbersome if you make it cumbersome, but I'm just trying to follow the direction, put it on. It has to be done within 1 minute of the phone ringing. So I just do it and we move on from there.
So
I don't know how the other two are doing it.
I just want to let everybody know, because just to describe it a little bit better on my end, meaning I didn't describe it as well, is that don't be surprised when you're calling any of these folks or any fabulous Medicare broker if they tell you, they read something and it's recorded, because that's what has to be done now. I know for a fact it wasn't done before, so it's new, and it could be off-putting if you're like, oh, I have to do Medicare. I was like, this is going to be recorded. You're like, oh, believe it. I mean, some of us are so used to it because so many things are recorded every time we call somebody, right? This conversation may be recorded for quality assurance, but just in case you're not used to it and you're surprised by it, don't be. This is the way it is now. As everybody has to do it. It's all of the brokers have to do some kind of recording when speaking with you. So don't be alarmed.
And I kind of say to them, this is what we're required to do. I will read you a disclaimer and then we'll move on. And they kind of don't even think about it. They don't. I haven't had anybody question about it, and I haven't said, well, we have to talk about certain things. I just do my normal thing, and as long as they're prepared that I'm just going to read them something for 30 seconds, whatever it is, it's gone fine so far.
Yeah, nothing's really changed, so it's just we're just saying it a little bit differently, getting them in the frame of mind that they know they're going to be recorded, and like Jane says, then just move on.
Yeah,
it is what it is.
Yeah. This came up because last year there were more complaints to CMS, the Center for Medicare Services, than there ever were in the history of it. And it had to do with those commercials that are somewhat aggressive and misleading or confusing. So because they had more complaints, which still were a very tiny percentage of people on Medicare, the government quickly reacted in this way. And I think they're going to refine the messaging over time. But they felt they needed to do something.
But just so that you're aware, do not be alarmed. I have a question, one more question here from Jerry, and then we'll wrap it up. I do want to say to everybody that their contact information of Al, Jane, and Stuart are in the chat right now. And for those that are listening to this recorded, it will probably likely be within the message when it's sent out to you. So Jerry asks, are we covered abroad if we get sick with Medicare? Does
All right,
anybody want
so-
to answer that?
Yeah, I'll jump in on that a little bit. It really depends on the plan that you're in, and the country that you're going to. So I tell people, if you really want to be safe, buy travel insurance. And that's an easy thing to do. Yeah, there's a cost to it, but there's also a cost to being even in a country like Canada and coordination of benefits with your plan. It can be somewhat cumbersome, but some plans do have international coverage, other ones don't, and so on. But also remember that even within the United States, and this is not about your question, if you're traveling or you get sick and you have a hospital network, like you're on a Medicare Advantage plan, and you need to go to an emergency room, you are covered and you are in network in any emergency room in the country. So you can literally have a heart attack, God forbid, go in through the emergency room, have bypass surgery in a hospital that's not in your network, and the claim will be treated as if you are in network. So never hesitate to go to an emergency room or start looking for an in-network one.
May I jump in with a
Great,
quick
Al,
point?
because that talks to what I've spoken about a lot of
Yeah.
times with the no surprise billing. So
I just wanted to make a
thanks.
quick addendum to that. In the practical sense, I've gotten the experience. First of all, original Medicare, federal government only covers you in the 50 states and the territories. That's it. The Medicare supplement that you might purchase to fill in the gaps, Medigap, they typically have a limited policy, call it $50,000 lifetime maximum, where they'll pay for that emergency coverage. So when I get those calls, people call me from Australia, wherever, and they say, I broke my ankle getting off a boat. So I say to them, don't send the bill to Medicare. They're not going to pay. When you get back, make sure that you got the bill, and the word emergency was somewhere on that bill. Because if the word emergency is on that bill, submit it to your supplement, they will reimburse you. And they don't coordinate with the travel insurance Al mentioned, meaning my travel policy could reimburse me, and the supplement. You may get back more than you spent because they don't actually coordinate the benefits. Each one pays individually. So that's a nice bonus in the Medicare supplements. But word emergency is very important on that bill. When people have come back without that word, it got declined. And I said, I had someone, I told him, call up Ireland, the doctor, tell him to put it into US dollars, the amount, and write the word emergency big on the bill. And then it got
Good.
covered.
That's helpful information.
Yeah.
Thank you. Thank you all. Thank you for your great questions, everyone. Thank you again to our fabulous panelists, Al, Jane, and Stuart. And I hope that you all found this very helpful. I know I did. I always learn something. And we'll see you next time on our next webinar. Thanks so much, everybody.
Thank you,
Thank you.
Nicole.
Thank you. So long.
Bye, guys.